Okay guys, so I'm going to demonstrate how I do myofascial flossing for my knee. Some people call this voodoo flossing. Some people call it myofascial flossing using voodoo bands. Whatever, it's all kind of the same deal. I'm using Rogue bands. I like the Rogue bands a lot. I think they're high quality. They're a little more expensive than some, but I've also used Wad Nation bands. Those are, the older ones were okay, then their newer ones, the band needs to be tacky, kind of sticky for it to work well. I feel like the Rogue bands are fairly tacky right out of the box. The Wad Nation bands, I feel like they used to be tacky, and now they come out of the box and they're actually really slick. And I have to use them a lot and wash them a lot before they start to get tacky. So I like the Rogue bands. I'm going to put some links in the description of this post. You can buy these on. These are on. I don't know if these are on Amazon. I know they're on the Rogue site. You can buy the Wad Nation bands on Amazon. Anyway, so we're going to get to it. So I like to have a red and a black. The red is tighter, stiffer stretch. The black is a little looser. I like to use a combination of these on my knee. The Wad band, they're on Amazon, those come in a 2-pack, one red and one black, so it's kind of nice. These you just have to buy separately. So I like to start with the red band, and I start with these rolled up. They are much easier to lay over if they're already rolled. Sometimes, despite my best efforts, as I start to unroll this, it'll slip and unroll, and then it's kind of a pain in the butt. But anyway, what I do is I stretch my knee out, I'm sitting on my weight bench here. You can sit in your dining chair or ottoman or couch or whatever, somewhere where you can straighten this knee out fairly straight. And I start, my red band is gonna be below the knee. So I'm gonna start wrapping in the middle of my kneecap-ish. And I'm gonna wrap relatively tight. And I'm just gonna work my way from the kneecap down. Do not be afraid to get this tight. It's gonna feel uncomfortable, but you're not gonna hurt yourself, okay? Now, if you just had a knee replacement or an ACL repair, a patellar fracture repair, you don't want to start this too early after surgery. If you're just having good old-fashioned knee pain, then this will be helpful for you. So I wrap about 4 to 5 inches down, and if I've got any band left over, I start going back up until I run out, and I take the tail of that band and I tuck it inside of one of the last loops that I made. Then I go to my black band. Same thing, I start mid kneecap, and this time I'm working my way back up. And again, I'm getting this nice and tight. This is not comfortable. It should not be excruciatingly painful. Again, 4 to 5 inches, and then I start wrapping back down. Tuck that in. Once I've got that snug, there's usually a tiny little window of skin poking out between the two bands. That's right about where I want it. Then I stand up and I do my best effort. 25 squats. And it hurts. It does not feel fantastic. If you can't do a flat-footed squat, you notice I'm on my heels, I'm not coming up on my toes, then you can grab onto something to help you squat, because the deeper you get, the more effective this is. Your kitchen sink works great. I'm holding on to my squat rack here. You can hold on to the upright of your treadmill. Something that's pretty stationary. Don't pull your dining table over on yourself, or a door jamb will be fine. But again, you're going for 25 squats. as deep as you can go. And then once you've done your squats, have a sit and unwrap your bands. Honestly, this is the best part because it feels super good to get these guys off. So then I would take these bands and you gotta manually roll them back up. It's just how it goes. Roll them back up and then I do the other knee. And I try to do both of my knees. If I'm really paying attention, I try to do both knees 2 to 3 times a week. Once a day is plenty. If it's a day I'm doing squats and deadlifts or going for a run or whatever, then I definitely want to do these, but you don't have to have a reason other than your knee hurts. You had surgery, it's stiff, maybe it's an old injury you didn't rehab fully, whatever it is. This little combo is incredibly powerful. You can get results after one time, but don't expect this to be a one and done deal. This is invest in these bands. You're gonna spend $25 to $35 on a pair of bands. Just invest in that. Set these next to your bed or in your dining room or wherever, or set an alarm on your phone. Do whatever it takes. Wrap these guys around your knees and do 25 squats 3 to 4 times a week, and you will notice a substantial improvement in your knee pain, range of motion, mobility, function. So hit me up if you have any questions.